What's up, pet pals? Welcome to Arden Moore's Four-Legged Life Show. Yep, it's me, your host, Arden Moore. Hey, there's this mysterious respiratory illness impacting dogs in some states. And here today, we are so fortunate to help us separate fact from swirling rumors is one of the country's leading veterinarians working on this issue. Please welcome to our show the chair from the University of Florida's Shelter Medicine Department, Dr. Cynda Crawford. Welcome, Dr. Crawford.
Thank you very much for having me.
Whoa, you never get a break, do you? There's always something bubbling up in the world of our pets and our health. I want to give a little backstory to you because tell us about how long you've been a veterinarian and been at the University of Florida, which is one of the most renowned veterinary schools in the country.
I have been a practicing veterinarian for 34 years. It's almost too much for me to count. And
Okay.
I have been at the University of Florida College of Veterinary Medicine for 25 years now.
And you were a child prodigy, right?
Oh, no. If you ask my parents, I was always a troubled kid.
Well, who not better to have a troubled kid than someone dealing with a lot of trouble in the world of dog health? So let's get into it because I'm seeing so many different reports. And I've got to tell you, years ago, I was an investigative reporter for the Fort Lauderdale Sun-Sentinel. And the best advice, Dr. Crawford, I ever got from an editor, he says, Arden, he had that voice. If your mother tells you she loves you, check it out. So that's why I'm coming to you. You're not my mother, but I'm saying it's separating rumor from substantiated facts. So I want to dive in. First of all, I hear this condition, this respiratory illness, being called different names and also being said, well, no, it's not new. Can we start? Can you help? Can you give us some clarity for what you know as fact?
All right. Well, I think most dog owners know the term kennel cough.
Yeah.
That's the most commonly used phrase to describe a dog with a new cough and probably sneezing and a running nose. And probably most dog owners have had kennel cough in one of their dogs over the years. And it's usually picked up when dogs are co-housed together.
Okay.
Or they congregate together in some sort of social setting. So this would be like
going to a dog park or boarding.
This would be dog park, boarding, dog daycare center, groomers. If you have a pack that goes on dog walks frequently, those sorts of activities where you have dogs coming from all parts of the community.
Yeah.
Unknown health status, and they're all together, nose to nose, sharing the same.
And we can say butt to butt. Come on, nose to butt. Yeah, nose to butt. That's the canine hello. So we've got that bubbling right there. So how is this kennel cough or is this something else? Or how would you right now in the stages of what you know, what is this? Because it's all over the headlines.
The pet dog owners and veterinarians alike are used to kennel cough every day of the year. So it's the most common respiratory disease in dogs. It's an infectious disease.
Okay.
And it can be due to many viruses, just like viruses that cause the cold, common cold in people. So we have many dog-specific viruses that can cause a respiratory infection, and we have a couple of bacteria that also can cause a respiratory infection. So it's a syndrome with many possible causes, not one cause. And
Okay.
We're very used to dealing with it every day of the year. And we also expect for there to be spikes in the numbers of dogs that become acutely ill with cough, sneezing, and runny nose at this time of year. Generally following the Labor Day weekend, which kind of starts off a whole series of holiday associated boarding, a lot of dog daycare center visits, a lot of social events for dogs in the community. Yeah. So typically that causes a spike in sick dogs every year. What we are hearing from veterinarians on the front lines, mm-hmm. and this is undisputed, is that they are seeing more numbers of sick dogs than they typically do or would expect to see this time. Okay. So that's an undisputed fact.
Okay.
And they're also reporting that many dogs are sicker than normal, than, again, they're used to dealing with. And they are seeing more cases of actual pneumonia in some dogs. And unfortunately, there have been deaths from the pneumonia. So that is what has raised the alarm. They're seeing more numbers of dogs sick than usual. Some of the dogs are progressing to pneumonia that can be life-threatening. And they also report that the dogs with pneumonia are not really responding to the typical treatment that's provided in that situation. So this has created a very intense media interest.
Well, come on, Doc. We love our dogs.
Yes. But so we don't, so what has happened is there's now the thought that maybe these increased numbers and sicker than usual is associated with some mysterious pathogen causing the illness that we do not know about. And so that's where sort of the fact and fiction story breaks down.
Okay. Okay. But you have been on some pretty heavy duty platforms. I did listen to the webcast that you all had, and it was featuring you and a veterinarian from UC Davis and one from the University of Guelph, which is in Ontario. So it's big enough that you big time people in shelter medicine and beyond and epidemiology, you're being called on like I'm doing right now. So so people are scared, I think.
I think initially there wasn't much diagnostic testing of these dogs that were becoming sick with a respiratory infection, or they were presenting to their veterinarian at a time frame that was beyond the diagnostic window. I mean, to diagnose the causes of these respiratory infections, we need to get swabs, and everybody's familiar with swabs.
Oh, yeah, we have swabs.
From COVID, but we do the same sort of sample collection from dogs with respiratory infections. But those swabs have to be collected in the first 4 days of illness, not day 7, day 10, or day 14. So there initially wasn't much opportunity for proper diagnostic testing. Some were done. And the thing that I think has been a positive outcome of the veterinarians reporting and the media picking up on the reports is that many veterinary diagnostic laboratories have reached out to the veterinarians on the front to help with sample collection and testing. So,
So everyone, we're speaking with Dr. Cynda Crawford. She's from the University of Florida. Her wheelhouse is shelter medicine. And we're going to dive in more after we take this break. You all know the drill. We got to sit, stay. We'll be right back.
Hey, have you heard? Four-Legged Life has a new digital newsletter. Here, let me show you how you get yourself subscribed. So you just type in Four-Legged Life and that'll take you to the website. There we go. And this magic thing just appears, and you type in your email address. I'll use, let's see, how about coolestdogever@gmail.com. That's me. And then you just click on this thing here. There you go. It's the new digital newsletter from Four-Legged Life. Get subscribed today.
Welcome back to the Four-Legged Life Show. I'm your host, Arden Moore. I am very honored to have as a guest on my show a distinguished veterinarian. Her name is Dr. Cynda Crawford. She's from the University of Florida. Her area of specialty is shelter medicine. She's been a small animal veterinarian. She's been in the academia world, so that's a 2-pluser for me. And we're talking about this mysterious respiratory illness and how everybody is trying to get a handle on it. And the headlines, just in your turf, south in Florida, Palm Beach County, their animal care and control had recently said, we're not accepting any more pets. I talked with Susie Goldman from the Tri-County Animal Rescue Group. She's not accepting any more dogs right now because they don't want to risk spreading whatever this is to the resident animals that may be pregnant, old, flat-faced, have respiratory issues. I mean, that's pretty serious to have 2 places in one county say, we got to be cautious. What's your take on that?
Well, I am working with the shelter in Palm Beach County that has recently limited admission of more dogs into the shelter. And the veterinarians in that shelter have identified a cause of some of the death of 3 dogs this week from a very rapid onset pneumonia that the dogs died from within a matter of hours. And
Is this the one called strepso?
Yes, this is a very characteristic story for a bacterial species called Streptococcus zooepidemicus. We call it strep-zo for short. We have known that this bacterial pathogen, which normally is affiliated with horses, but it also can colonize dogs and grow in the upper respiratory tract of dogs. And we have known for years, myself, going back to 2005, that this particular bacteria, strep-zo, if it is introduced into the dog population housed in shelters, it can cause several cases of this very fatal pneumonia in dogs. So it spreads.
It's like, is it bleeding in the lungs or?
Yes, it does. And the dogs die from what we call hemorrhagic pneumonia. So there is bleeding into the lungs, and this effectively, they die from suffocation. They can't exchange air in the lungs. It's very sad, but it happens without warning. There's no prior warning that they have it. And once the only thing you notice is they go from looking great, healthy, to having very difficult breathing and then dead. So,
and those 3 dogs at the Palm Beach County Animal Care and Control, they were named Mimi, Marcus, and Africa, and they were ages 2, 3, and 8. So these were young, relatively young dogs, about medium to large size.
Yes, that were not sick before they presented with difficulty breathing. So this is very characteristic of streps in the shelter dog population. Our program is used to working with 1 to 2 shelters per year that have strep-zo problems in the dog population.
Okay.
I am up to 9 shelters this year.
Wow.
And we'll pick up another one next week. So it's 10, all of which are spread across the country. All of these strep-zo cases in these 9 shelters today have been confirmed by diagnostic testing. And so I'm alarmed by the fact that it's just like exploded in the shelter dog population for some unknown reason that we're trying to identify why all of a sudden this bacteria is spreading so efficiently across the country. In addition,
Now, and can I ask you this? So a bacteria versus a viral,
Right.
you can't have an antibiotic, right? That will help it, right? If it's
oh, it
bacteria.
is, since it's bacteria.
Okay, that's why
can
you
be-
got the DVM after your name. Clarify.
Bacteria are susceptible to being killed by antibiotics.
Okay.
Viruses are not. And of course, the strep zo is susceptible to certain antibiotics that we use in veterinary medicine. But really, by the time you notice a dog is having problems breathing, it's too late to rescue them with antibiotic therapy. So that's the unusual nature of strep zo. I will say that actually, for the first time in many years, I'm now hearing reports from private practitioners, veterinarians and primary care practices that are seeing dogs with quick onset of pneumonia and diagnosing strep zo through testing. So it's not just a shelter dog situation anymore. It seems to even have spilled over or at least moving into the pet dog population.
So we have a few minutes left. So I really want to hone in on what we can do, some cautions. I mean, we can't have our dogs live in an isolated bubble. I have 2 dogs, Kona and Emma. They have my cousins, canine cousins, Jackson, Jeannie, and Oliver, and they're all up to date on their shelters. They don't go to dog parks. So what are some do's and don'ts that we can exercise cautiously without panicking to have our dogs get enriched, but not be risk of getting strep zo?
Well, I'm glad you mentioned the word panic because the intense media reporting has really stirred up fear and panic in dog owners, and they feel paralyzed about what to do with their dogs. So don't panic. Please realize that the vast majority of dogs with a respiratory infection recover fairly quickly without any complication. The proportion that develop pneumonia is very small.
Okay.
And those that develop pneumonia, the proportion that die is even smaller. And this is kind of what we expect for respiratory infections in dogs.
So when people like I do, I keep up to date on the vaccines. So my dogs, they've got Bordetella, leptospirosis, the core vaccines. So one message is make sure your dog is up to date.
Yes, please be sure that your dogs are vaccinated at the proper intervals with a vaccine that helps protect against Bordetella bacterial infection, which is what most people associate kennel cough with,
right?
As well as a couple of viruses that cause the common cold-like syndrome in dogs, and that's adenovirus and parainfluenza virus. There is no vaccine for the other known canine respiratory pathogens except for canine influenza virus. We do know that canine influenza virus is circulating in dog populations in South Carolina and North Carolina, as well as some other states. So vaccination against canine influenza is another tool.
Okay, good. What about should I take my dog to the groomer?
Well, and so I think just awareness that there is a risk for exposure to a respiratory pathogen when your dog goes out in the community and socializes with other dogs, whether it's boarding, dog daycare centers, dog park, going to the groomer, there's always an inherent risk with that activity of picking up a respiratory illness. At this point in time, I don't think that dog owners should really change their social schedule for their dogs, but they need to be sure they're not mingling with a dog that's ill looking.
Okay.
Don't do that. If you have a pack, dog owners with their
Mine
dog,
do.
that
Yeah.
you normally walk with. Just keep doing that, or there's a pack that goes to the dog park all the time together. I think I would continue those activities. And if you have questions or concerns,
Yes.
please contact your veterinarian to discuss them.
Not Dr. Google. Come on, Dr. Crawford. You're lazy.
I think Dr. Google may lead dog owners astray a bit.
Okay.
But I would go to reputable sources such as veterinarians. So again, this is the time of year we expect respiratory infections in dogs. Don't panic. Most dogs recover uneventfully, just like most people with colds. So just be aware. And if there are any documented reports of some spread of respiratory illness in your community, then you want to take more precautions about where you take your dog. But you're right. No one can live in a bubble. No one's going to be happy with that. It's not good welfare.
We just have a few seconds left. How do people find out about you, Dr. Crawford, and a parting message to us dog lovers?
Information about myself and our program here at the University of Florida College of Veterinary Medicine is accessible through ufsheltermedicine.org. ufsheltermedicine.org. There's all sorts of information about me and our program and what's happening with this mysterious illness.
All right. I really, truly appreciate you being available. We need to get fact from fiction, and we are better humans because we have dogs. Wouldn't you agree?
Absolutely. And by the way, I will be boarding my dogs for the holiday week coming up. So I'm moving forward with my plans.
And shout out to your dogs. Who are they?
I have, they're all from shelters, different
Okay.
shelters, but I have Maggie, Taylor, Ruby, and Sweet Pea.
And just to help, is Taylor spelled like a Swiftie, or how is Taylor spelled?
Taylor is a Swiftie, but a male Swiftie.
So TaylerLor?
Correct.
Okay. All right. Dr. Crawford, again, thank you for being on our show.
Thanks so much for making our tails wag by watching this guest interview from Arden Moore's Four-Legged Life.
Four-Legged Life.
Make sure to subscribe so you're up to date with all of our Four-Legged Life content.
Four-Legged Life. Four-Legged Life.